Today we're going to be talking about the hip flexors. So the hip flexor muscles is the psoas and the iliacus. So the psoas attaches to the back of your lumbar. So the lumbar, the L's that you have right here, it attaches to the front, and then it goes right through the top of your thigh, and then you have the iliacus muscles. So iliacus muscles, there are other hip flexor muscles. Pretend your pelvis is kind of like a bowl. Okay, you have muscles that attach to the back of your bowl, and they attach to the front of your thigh. So that's where you get the term of psoas. So iliacus muscles and the psoas together, they attach to the front of the thigh. When those hip flexors are tight, it affects your extension. It affects your extension. So it affects the torque that you build on your glute. So you might not posteriorly tilt your pelvis efficiently. Okay. If it's tight, you also, an example, when you're doing squats, you tend to lock your knees a lot more than locking your hips. Does that make sense? So just because the tissues of the psoas, the psoas and the iliacus, they attach to the front of the thigh, it starts to affect the tissues of the front of the thigh, which is the quads. Okay? So that's why we have to lengthen them. So a good way to lengthen these tissues is by using a roller. Okay? Roller, releasing. So this is kind of like a tenderizer. It softens the tissues of your body. So any tissue, I'm gonna say it right now, any tissue that you feel pain, it's usually because the tissue is unhealthy. Okay, so one way to address that psoas or that hip flexor muscle is addressing it right on the middle of the thigh. So not on the middle of the thigh, but on the middle of the joint. So you're gonna dig into that tissue, okay, just like that. You're gonna I like bringing the other leg to the outside just to square my hips a little bit better. So you keep digging into that joint, and you keep pushing that heel straight back. So keep pushing that heel straight back. Keep pushing that heel straight back. The reason I like pushing the heel straight back, and sometimes I like to hold it, is because when you're in this position, you see my ankle, it's in dorsiflexion. So dorsiflexion is pretty much, you're activating the glute. You activate the glutes in dorsiflexion, and when you activate the glutes, the opposing muscles lengthen. So the opposing muscle of the glute is the hip flexor. So the tissues of the front of the thigh, they lengthen, okay? And I like to hold it there, and I like to dig it in, just because it softens the tissues of the front of the thigh, okay? So keep digging into that joint, keep pushing that heel straight back, and then I want you to hold it at some point. You could even bring the foot off the ground at some point, if you could bear the pain, okay? So if it pinches, or if it pulls, if it feels uncomfortable, then you're in the right spot. That means that your tissues are unhealthy. Okay, so keep digging that heel straight back, keep going forward. Sometimes I like to bring the knee down and up, okay? But as long as if your leg is shaking, that means you're in the right spot. So the tissues are starting to lengthen, okay? So you do that on both sides, okay? As soon as you do that on both sides, you're gonna go to an exercise that's gonna lengthen the tissues. So you already did the tenderizing, so now you're gonna get into a position that you're gonna lengthen the tissues. So you lengthen the tissues by finding an exercise that's gonna emphasize the pressure on the hip flexor. Okay, so I like to do half kneeling hip flexor stretch. I like to stay straight. So an example, this one, just like this: knee, hip, shoulders, and head. Okay, everything's in a straight line. 90 at the hip, 90 at the knees. Same thing on the front leg. Okay, make sure that the toes are tucked in the back, so you can activate that glute. Okay, activate the glute, the hip flexors lengthen, right? So push that knee down, reach overhead as high as you can. Push that knee down, reach overhead as high as you can. At the same time, I want you to push that bell button in. Push it as high as you can. So it's pretty much, you're enforcing this pressure down on that knee, and you're enforcing the pressure up towards the ceiling, right? And at the same time, you could bring the knee slightly off the ground, but just continue to push the knee down, okay? So an example, you can reach up as high as you can, reach up as high as you can. You continue pushing the knee down, even though it's off the ground. Keep reaching up, keep reaching up, keep reaching up, keep reaching up. Keep reaching up, keep pushing the bell button in, and relax it. Good, perfect. So you might feel pressure on the knee. That's okay. That means those are tensile forces that your body's used to. So the tissues are lengthening. Okay. You might feel it on the knee. If you don't feel it on the knee, then you're good. Then you just have to worry about the quads. If you feel it on the thigh, that means the tissues are stretching out on the thighs. Okay. Eventually, you're gonna feel it on your hip flexor. Okay. So make sure that you're pushing the knee up. So one more time. Push that knee straight down into the ground, reach overhead, bring the knee slightly off the ground, push the bell button back, keep reaching, keep reaching, keep reaching, keep reaching, keep reaching, keep reaching, and then relax it, good, just like that. So you continue to do that. I like to hold it for 20 seconds, do 4 on each side, and you'll feel the difference eventually. You'll feel like your joint opens up, okay? As soon as you soften the tissues of your hip flexor, you move into decompressing that lower back, because the lower back is so compressed because of the posture that you're usually in. So because you're not really engaging the whole core, you're compressing the lower back because of you get tired over time, over the day. You start getting lazy, and you're not in a position where you're activating your core the whole time. So I like to do this with my people, my clients, if you guys know. So you keep the thigh right in the midline, okay? Make sure that the shins stay nice and 45 degrees, okay? Make sure that your thigh doesn't pass the midline, just like this, okay? Make sure that your thigh doesn't go too far, okay? You just try to hold on to those knees, and you try to rock on your lower back, just like this. So rock on your lower back. Try to put pressure on the area that you feel more, try to put pressure on the area that you feel like you don't rock smoothly, if that makes sense. So this is how you do it. So an example, if you feel pressure, if you feel like you don't rock smoothly on your right side, then continue rocking on that side. So you put pressure on the area that you don't rock smoothly, okay? So you continue putting pressure on the side that you don't rock smoothly. So an example, just rocking back and forth, try to go to your tailbone, but make sure the heels don't touch the ground, okay? So just like this, and then, so you put pressure, you continue rocking the side that you don't rock smoothly. Does that make sense? So if you feel pain, then continue rocking on that side, okay? And then go to the other side. If you feel like you rock smoothly, then you don't need it. So continue just rocking on the side where you need it the most, okay? Where you need it the most. So you're trying to decompress that spine. Eventually, when you decompress the spine, you should feel your core more engaged, okay? So more engaged, okay? Perfect. As soon as you do that, we move into the lateral side of your thigh. So the lateral side of your thigh, you're right here, okay? So I like to do this exercise where you, it's called internal knee drop, okay? So you drop the knee inside, make sure that the knee's under the hip, make sure that you're on the inside of your foot, okay? And then you're gonna bring it as low as your body lets you. The other leg on the other side, you're gonna bring it on top of that knee, just like this, okay? So the knee directly under the hip, okay? You're on the inside of your foot, okay? All you're gonna do is just make sure that you're pushing your belt button down. You have your lower back, try to bring your lower back to the ground, nice and flat, okay? And all you're gonna do is gonna push up on that left knee, and you're gonna push down on that right foot. So you're competing against the middle, just like this, you're competing. So keep pushing the head down, keep pushing the head down to create tension, and then keep pushing the lower back down to create core stability. And then I want you to, on that left knee, I want you to push it up as high as you can, and that foot on the right, I want you to push it down. So you're competing against the midline, competing up and down, competing up and down, competing up and down, competing up and down. You're trying to get as much stability as you can on your back, on your head, okay? And you're trying to drive the knee up on your left side. So eventually you're gonna feel your lateral side of your thigh lengthen. You're gonna start feeling pressure on the lateral side of your thigh, right?